Hello all, I am Dr. Jaykumar Mehta, Senior Consultant Interventional and Transplant Pulmonologist, Allergy Asthma, Sleep Disorders and Chest Specialist, working at Epic Multi-Specialty Hospital, Ahmedabad. Today, on the occasion of World Lung Day, I come here to highlight certain facts about lung health, how to keep it and preserve and maintain it. So as every year we celebrate World Lung Day on September 25th, this year's celebration theme is Clean Air and Healthy Lungs for All. It means that the cleaner we keep the air surrounding us, it will directly impact to our lung health, and irrespective of the social strata, it will benefit to all. So mankind has been blessed with a pair of beautiful lungs which works throughout the life. Like when the child is born and breathes, it's where the life begins. And throughout a day, an adult human breathes in and out around 17,000 to 22,000 times a day. Yet, we are hardly aware about this enormous breathing process. But once we become aware, it becomes a symptom of a disease. Human lungs have been blessed with more than 500 to 700 million air cells, which gets the oxygen from the air and transfers into the bloodstream, and at the same time it removes carbon dioxide, the stale air from the lungs, and exhales back to the environment. With that, it maintains and sustains the life and oxygenates almost all the organs of the body. Hence, both the lungs are necessary to have a good and healthy life. Common symptoms of respiratory diseases include coughing. Coughing is a reflex which happens quite frequently and very commonly, but it can sometimes indicate various and serious respiratory disorders. Sometimes this coughing is in great intensity which keeps you awake at night. It sometimes causes chest pain as well as urination in certain females. When this happens, it is a sign of grave disease and one has to consult a pulmonologist. Apart from cough, if production of sputum, phlegm, expectoration, particularly whitish, yellowish, greenish, or sometimes tinged with the blood, it becomes a symptom of a serious respiratory condition. Any cough or sputum production more than 2 weeks, it demands a specialist opinion. And if you are suffering from those, you must have to consult a doctor. On top of that, when you are having gradual onset progressive breathlessness, initially one was able to do certain activities, but now they are feeling breathless on that. It means there is serious respiratory condition can be happening. Apart from this, loud snoring, excessive daytime sleepiness, poor performance, difficulty in concentration, difficulty in driving, this all can lead to a very serious respiratory disorders known as sleep apnea. And presence of wheezing, that is whistling sound coming from chest, or noisy breathing, chest tightness, chest congestion, these are all sign and symptom of airway disease like asthmatic attack or asthmatic bronchitis. To summarize, if there is long-standing cough associated with sputum, coughing up blood, a presence of breathlessness, presence of chest pain, and loud snoring, presence of wheezing, these all are various symptoms of respiratory disorders. So most common respiratory diseases are allergic asthma, bronchitis and infective bronchitis. Apart from that, there are infective conditions like pneumonia that can be due to virus, bacteria or fungus. Tuberculosis is very common respiratory disorder. COPD, that is a lung condition happening because of chronic exposure of smoking, cigarette smoking, chula smoking, and environmental tobacco smoke because of the air pollution. Interstitial lung disease, ILD or lung fibrosis, is also a very serious respiratory condition. Apart from that, sleep apnea, where one snores aloud and has difficulty in performing day-to-day work, excessive daytime sleepiness, can also become a major and concerning respiratory condition. Presence of air or fluid in the lungs covering known as pneumothorax and pleural effusion are also common respiratory condition. Lung cancer, that is presence of cancerous cells in the lungs or in pleura at our lungs covering, can also very life-threatening respiratory conditions. So according to the person having a condition, the diagnostic modalities are aimed to increase the precision and to tailor the treatment, personalize the care plan. So if a person is on physical examination and detailed history taking found to have been suffering from allergic bronchitis, asthmatic bronchitis, then the investigative workup will include pulmonary function testing, lung oscillometry or impulse oscillometry testing, and allergy tests which include blood test as well as allergen skin test. And one may need to do a radiology testing to exclude other diseases. If a person is known to be happening to suffer from COPD, then pulmonary function testing, X-ray chest and 6-minute walk test is the modality of choice. If the person is found to be suffering from interstitial lung disease or a lung fibrosis, then one may need HRCT thorax, CT scan of thorax and lung imaging. On top of that, they may need advanced lung function testing like diffusing lung capacity testing, lung volume testing, 6-minute walk testing, as well as certain higher blood tests to include and come to a precision diagnosis. Sometimes they may even need bronchoscopic lung cryobiopsy. If the person is suffering from a pneumonia where we are not able to get a clue from what infection it is, then one may need bronchoscopy. If the person is happen to be suffering from mediastinal lymph nodes, these are the big glands between the chest, then one may need EBUS or endobronchial ultrasound. If a person is suffering from air or fluid in the lungs, they may need pleuroscopy or medical thoracoscopy for detailed diagnostic evaluation. And if a person seems to be having obstructive sleep apnea, they may need sleep study. So the diagnostic modalities change according to the pre-test probability of a person having certain respiratory conditions, and it is varied and differs from the doctor to doctor. So based on the diagnosis, a final diagnosis the person has, the treatment modality changes. It may be simple bronchodilator treatment. It can be related to the inhaled medications like inhaled corticosteroids. There can be mucolytics which thins out the phlegm and helps clearing the lungs. Then there can be use of certain devices like inhaler devices which includes MDIs, DPIs or nebulizers. If a patient is suffering from sleep apnea, then one may need to give PAP therapy like CPAP or BiPAP. And if a person is sick enough, we may need to put patient on ventilator and give mechanical ventilation. And on top of that, there are certain modalities where we need to increase and increase the lung function and decrease the impact of the disease by pulmonary rehabilitation. So in short, it is combination of all the pharmacotherapy, the physiotherapy and exercises as well as preventive measures, and use of certain devices when it comes to treatment of respiratory disorders. So to preserve and maintain your lung health, one must stop smoking and don't smoke. Second, we need to keep the air in our surrounding clean. So help in contributing the increase in the air quality of the surrounding environment by reducing indoor as well as outdoor air pollution. Third, we need to do deep breathing exercises like yoga and pranayama. Fourth, eat healthy food rich with the antioxidants. Fifth, drink plenty of fluids according to your physician guidance. Sixth, always vaccinate yourself with influenza and pneumococcal vaccinations. And 7, consult a local doctor pulmonologist if you are suffering from any of the respiratory diseases. So Department of Pulmonology, Epic Multispecialty, Ahmedabad is equipped with state-of-the-art infrastructure to deal with simple as well as complex respiratory disorders. From advanced pulmonary function testing, which includes impulse oscillometry or lung oscillometry testing, diffusing capacity testing, lung volume testing to walk test, from a dedicated sleep study suite to a dedicated interventional pulmonologist suite equipped with bronchoscopy, bronchoscopic lung biopsy, endobronchial ultrasound, pleuroscopy as well as cryobiopsy, and a good CT thorax and radiology unit for transthoracic lung biopsy and ultrasound guided procedures with allergen testing, both in vivo, in vitro, that is blood test, as well as allergen skin test. We have everything under one roof, and this department is one of the most advanced department of pulmonology of state of Gujarat. Thank you so much for your patient listening.